Yeah, me too.
Stop and read. No, I'm just kidding. Stop. Okay. All right.
Blackmail.
You can blackmail me. Okay, so let me start off with external features. Okay, so we are looking at the anterior longitudinal sulcus. Okay, you know that's anterior because, again, you have to orient yourself as far as front and back on the heart. Okay, so anterior and posterior, I should say. So here you have a thicker myocardium, you have a thinner myocardium, so you know that this is left, this is right, so therefore this is anterior, this is posterior. That's a key thing before you do anything else. Okay, so this depression or sulcus is the anterior longitudinal sulcus. That's where you find all the blood vessels, a lot of blood vessels, I should say. Okay, and so that goes from left to right. Here at the apex, or that pointy area, is referred to as the apex. All right, and the heart sits on the base within the thoracic cavity. Okay, so the back right here, that's the base. It's on the back. All right, layers of the heart wall. On the surface, epicardium, epi, surface. Myocardium is the muscular layer, so that myo prefix. And then whatever lines the inside of the chambers, and you can actually see that membrane right here, endocardium. Okay, so endocardium. Okay, so it's just a thin membrane that lines whatever surface. Epicardium, myocardium, and then on the surface of the cavities, endocardium. All right, now moving on along. Chambers of the heart. Okay, again, left, right, anterior, posterior. Got that oriented. So this would be the right ventricle below here. Okay, so right ventricle here. And then above, so then this structure here, since I'm here, I'm going to say that this is the tricuspid valve. Mm-hmm. Okay, and above that, where my pointer's inserted, is the right atrium. Paparazzi. Okay, sorry. So right ventricle, tricuspid valve, and then right atrium above it. Okay, now on the other side, we have the left ventricle here, and then that would make that the bicuspid valve. Okay, and then where the pointer's inserting is the left atrium. Okay, all right. So now, moving on ahead. Okay, so now I want to talk to you about the septa. Okay, septa is going to be a wall that separates two spaces here. We'll start off with the better one. I don't like that one. Okay, this is
the big one's a good one.
Okay, so again, this is interventricular, separates the right ventricle from the left ventricle, so interventricular septum. Okay, atrioventricular is basically going to be horizontal across, more than likely on the model. I mean, it's just because of the slice, but it would just be like that. And then the interatrial septum, I like it on this one here. Reason being is that you can actually put your finger between within the base of the pulmonary veins and then the inferior vena cava, and you can actually feel this wall. And actually, in this wall, you will find that fossa ovalis that I talked about. So you can put your fingers in there and feel that weakened area. Okay. So, all right. So interatrial septum with the fossa ovalis there. Now, valves, we've already covered the tricuspid and the bicuspid, so let's talk about the semilunar ones. Okay. Now, key thing with the semilunar, the base of the pulmonary trunk and the base of the aorta. Okay, so here's the pulmonary trunk. If I go to the base of it, okay, those flaps that you see here that I'm pulling on, let me get a grab on them. Okay, that is the pulmonary semilunar valve. Okay, so at the base of the pulmonary trunk, you find that. Now, here's the aorta. Okay, and if I pull up on this and out, so this is the left ventricle, so the vessel that takes blood out of the left ventricle is the aorta, and there's my pointer, it's coming out. Okay, so therefore that means that there is a semilunar valve right in here, and I'm pulling on it, so that's one of the cusps there. Okay, so that's the aortic semilunar at the base of the aorta. Okay. All right, now other structures. Chordae tendineae, nice ones here. Just those strings that connect from the atrioventricular valves to this structure here, which is a papillary muscle. So this mound, or kind of like this cone-like muscle here. And let me show you another one of those. So here's chordae tendineae, and then that would be a papillary muscle that it's attached to there. Okay? All right, trabeculate carne is the raked appearance on the ventricular wall. So, I mean, that's very nice right there. So just, you see how it's not smooth, the raked appearance. Okay, I've already done the fossa ovalis, so let's move on to the ligamentum arteriosus. So, aorta, pulmonary trunk, ligamentum arteriosus. There. Okay. Now, other vessels here that you should be able to identify on this, and I always go back to this one because it's so it's clear cut. Now, again, pulmonary trunk, aorta, here and here. Okay, so let me just turn it around. So here's the posterior. So this is superior vena cava. This is inferior vena cava. So these fingers will touch. They're going into the same chamber. Superior vena cava, inferior vena cava. Okay. Now, since I'm on this back side, remember there are 4 vessels that take blood to the left atrium, the 4 pulmonary veins. You can't see 4, but what they've done is they've cut this so far in so that you can actually see those 4 points, but just know that there was 1, 2, 3, 4 vessels coming off of this, and this is leading into the left atrium. Okay? All right. Coronary vessels are on the surface of the heart itself that are going to supply blood to the myocardium. Branches off of the aorta, you do not need to know on these here. Or if anything, the branch coming off of the aorta, the first one here is the brachiocephalic trunk, but further out, you know. Okay. All right, and that's pretty much it. Thank you.